Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you.
Welcome to another facilitation section on PHS 311 Child Health. Last week we discussed immunization schedule and compared it, the WHO schedule, and compared it to the national schedule. We also looked at the vaccine preventable diseases and described how the schedule for vaccinations are for these diseases. And we looked also at vaccine technologies and the new developments in vaccine technology globally. Today we'll be looking at topic 6, integrated management of childhood illness. At the end of this lesson, we should know the concepts of integrated management of newborn and childhood illness, and then understand the strategy, objectives, and classification of integrated management of newborn and childhood illness. Before now, we had integrated management of childhood illness. But a couple of other things were introduced to capture the newborn as well as a component of that management. So it all formed a bigger picture of integrated management of newborn and childhood illness. Every year, about 9 million children in developing countries, that's what we call the low and middle income countries, die before they reach their 5th birthday. Many of them during that die, especially at their first year of life. Ethiopia has one of the highest under 5 mortality rates, with more than 321,000 children under the age of 5 dying every year. So, integrated management of newborn and childhood illness was developed because over 70% of deaths were due to malaria, diarrhea, pneumonia, measles, and malnutrition. So these diseases usually are reasons why children, or parents take their children to seek for health care. At least 3 out of these 4 children who come to health facilities come down with these diseases. So because these diseases are common in these low and middle income countries, and more than 70% of deaths result from these diseases, this brings a picture of the integrated management of newborn and childhood illness. So what are the reasons? Why was integrated management of newborn and childhood illness? Why did it become an issue? Why was it developed? Now, like I said, those common illnesses or diseases that we mentioned, malaria, pneumonia, malnutrition, diarrhea diseases, were common findings in children. Most of them present with at least 2 or 3 of these conditions at a time. So, this brought about the need that these diseases need an integrated approach, a combined approach in its management, so that such diseases can be managed in a holistic way, since a child could present with 2 or 3 of these diseases at a time. So this integrated management or integrated approach takes into account that all the child's problem, including the major childhood illnesses, in the assessment and treatment of such illness in a child. So that led to the integrated management of newborn and childhood illness strategy. This strategy, the integrated management of newborn and childhood illness, integrates measures for health promotion, health prevention, and then the integrated management of those childhood diseases. So you are not just involved in the management of those diseases, you are also involved in health promotion and prevention. And in the management of these childhood diseases, early detection and effective treatment is the key. So health promotion of healthy habits to the mothers and the family and the community is also important in this strategy. So this brings us, what are the objectives of the integrated management of newborn and childhood illness strategy? What are the objectives of this strategy? The primary objectives of this strategy is to reduce mortality and morbidity associated with those major causes of diseases in children that are less than 5 years of age, and also to contribute to the healthy growth and development of children. Those are the key objectives. You are not just reducing mortality and morbidity of those common diseases that are in children under 5, you are also helping through health promotion and prevention in contributing to the healthy growth and development of children, which is the primary objective of child health. So what are the advantages of integrated management of newborn and childhood illness? It has helped to promote the accurate identification of the childhood illness in outpatient settings. The strategy has helped to identify those childhood illnesses through the lay down guidelines. It ensures appropriate combined treatment of all the major childhood illnesses. It also strengthens counseling of mothers or caregivers, and also strengthens the provision of preventive services as well, and speeds up referral of severely severely ill children, and aims to improve the quality of care of sick children at such a referral level. So, what constitute the components of the integrated management of newborn and childhood illness? The components basically is on improving case management skills of health workers, so that health workers are trained appropriately to manage cases when they see them, and identify cases when they see them and manage them appropriately. By doing that, it helps to improve the overall health systems, and then fosters and improves family and community health practices. Who are the children that are covered by integrated management of newborn and childhood illness protocol? Sick children generally, who are from birth up to 2 months of age, young infants, and then sick children who are also from 2 months up to 5 years of age. They are also categorized as a sick child. So it's not just the young infants, it's also from 2 months to 5 years. Generally, children who are under 5 are covered by integrated management of newborn and childhood illness protocol. So how do we classify illnesses on integrated management of newborn and childhood illness? The illnesses are classified based on color-coded triage system. You have the pink, you have yellow, you have green. Based on what you identify clinically by the clinicians, the clinicians identify these symptoms and what we call the diagnostic criteria. The diagnostic criteria, when those criteria or those identities or elements of diagnostic criteria shows pink, it indicates that the person needs urgent hospital referral or admission. And when those diagnostic criteria, the symptoms and the clinical findings indicate yellow, it shows that there should be an initiation of specific outpatient treatment for such a child. And when it indicates green, it means the child needs supportive home care. So, we've learned the concepts of integrated management of newborn and childhood illness, and we now know the strategy and objectives and the classification of integrated management of newborn and childhood illness. In our next lecture, we will look at growth monitoring. Thank you for listening.